Today, this is Outbreak News This Week. My name is Robert Harriman, and this is your source for all the news about worms and germs. And the website is outbreaknewstoday.com, outbreaknewstoday.com. Well, let's start out with some stuff that's going on in the state of Florida that you may need to know about. And down in Sarasota County, they are working up an outbreak of measles. And there's been 4 kids down in Sarasota County that have been diagnosed with measles. And according to the Department of Health down there, the children who have close contact with each other were not, surprise, surprise, vaccinated. The DOH is investigating the locally acquired infections. The source has not been identified yet. And according to DOH Sarasota Health Officer Chuck Henry, he says, "We will continue to investigate, but we would like families to know that their children could be exposed to diseases like measles anywhere. And unless they're protected with vaccination, they are risking potentially serious health effects for their child. We encourage all parents to fully vaccinate their children to protect them from diseases like measles." It's really so unfortunate that I have to say this almost every single week here, but yeah, you have to. You got to keep on pounding it and pounding it and pounding it, and so that's going on in Sarasota County, and hopefully soon we'll find out what the source was of the virus. Also, kind of keeping it kind of close to home up in Hernando County. It's probably about a couple of weeks ago, I talked about how the state of Florida has been seeing an increase in hepatitis A infections, and Florida's just joining a dozen or more other states with just tons and tons of hepatitis A infections among their MSM population, their homeless population, their injectable drug using population. And Florida seeing some increases this year, and it's been pointed out that in the Tampa and the Orlando area are especially hit hard so far. But this came out today, Thursday, in Hernando County, where the health department up there is notifying people that went and ate at the Zigzag Scallop Restaurant on Calienta Street in Hernando Beach from December 1st to December 3rd. Apparently, one of their food service workers up there tested positive for hepatitis A. So they're advising, if you were a patron of this restaurant and you're not previously vaccinated, you should get vaccinated. And they're holding some vaccination clinics up there. I guess it goes on every day at DOH Hernando, the Spring Hill office. And they're also offering a special vaccination clinic on Saturday in Spring Hill. So I encourage, Saturday will be passed by the time this airs. But yeah, vaccination is very important when it comes to preventing hepatitis A. So just want to keep you notified about what's going on in Hernando County. Well, I don't know, a week or 3 weeks ago, I kind of touched on this issue with rhesus macaque monkeys here in the state of Florida. And there was a study, it's in the journal called Journal of Wildlife Management. And they were doing a population estimate and look at different management options for these rhesus monkeys that were introduced to the state decades and decades ago. And they give a little history that approximately 12 rhesus macaques were introduced to the forest along Silver River in Central Florida. There was 2 introductions of macaques in the 30s and the 40s, and the idea was to increase tourism. And it was on the land which is now known as Silver Springs State Park. Well, we can go on a little bit farther with this. A very interesting article in National Geographic. And they say in the heart of Central Florida lies Silver Spring State Park. This patchwork of forest and wetlands with a spring-fed river flowing through it. It was once known for scenic vistas and native wildlife, but for the past 8 decades, the park's biggest draw has been its monkeys. Yep. The park has been home to 300 rhesus macaques. This is not a monkey that's native to the state of Florida. They are native to South and Southeast Asia. And they are rapid breeders. And the latest study estimates that the monkey population currently, which is, 300 to 400, will probably double by 2022, just a few short years away, unless somebody steps in and makes some moves on this. And the researchers are concerned because not only is there going to be this increase of monkeys they predict, but the increase could have a real health effect on visitors to the park. And one of the things that there's concern about is a virus, a herpes virus that is normally carried in a percentage of rhesus macaques, and that's called herpes B. And that's going to be part of our main topic in the first half today. But a little bit of history, National Geographic does a good job of pointing this out. The primate problem began in 1938 when a tour boat operator known as Colonel Tui released 6 rhesus macaques onto a small island, which is now part of the state park. He bought the monkeys from a primate dealer in New York City, and his plan was to do some kind of a Tarzan-themed attraction. But not understanding rhesus macaques, his plans quickly unraveled. Right? Tui had no idea, and I didn't until I actually read this, that rhesus macaques are really strong swimmers. So it wasn't even days or weeks, but it was just hours after arriving on the island. These monkeys escaped. They went into the woods, they swam across the water and got away. And so what happened? Well, Tui went back and bought some more and tried to replace them. Surprise, surprise, they escaped also. And what we had by the 1980s was hundreds and hundreds of rhesus macaques spread out across this, multi-thousand acre park. Well, the population continues to expand and perhaps with increasing speed. According to Jane Anderson, she's one of the researchers of the study. She's a wildlife ecologist at Texas A&M. She says that the population is growing about 11% annually. So yeah, it's growing at a very, very good pace. So they're looking, what can we do to get this under control? They're looking at sterilization. They're looking at removals and some other things like that. Now, like I mentioned, there are people out there that are concerned about this human to rhesus macaque interaction because these monkeys are not really afraid of humans like some other animals, and they can be pretty nasty. And there's been several displays of monkeys getting aggressive that led to some park closures, including one last summer when one of the macaques charged a family walking on the park's boardwalk. And these macaques also get outside the park and cause their little shenanigans and mischief. And there's even photographs of them going through a deer feeder outside a house in Ocala, Florida. And these monkeys will stray from the home colony. They will show up in all kinds of different towns, and they can really survive on a lot of different diets, right? They're primarily herbivores, but they'll also eat insects and bird eggs and the like. They're not super aggressive unless you really get pretty close to them. And if you try to feed them, then that's one of the concerns, right? With this animal interaction. Well, again, they're worried about the possibility. Of course, there's a possibility of rabies, right? Anytime you have a mammal. But there's a bigger concern with these monkeys is herpes B. And in National Geographic reports, earlier this year, scientists from the CDC discovered about 30% of these monkeys carry herpes B. Pretty rare, but highly virulent, highly pathogenic. Now, there's only about 50 human cases of herpes B ever documented. Kind of a recent one was in 1997, where a 22-year-old research assistant died after getting bodily fluids in her eye from a captive monkey. So here she is working in the lab. The monkey spits or does whatever, and it gets into the lab worker's eye, and shortly after, she is gone. So let's go ahead and talk a little bit more about herpes B. What is it? What happens if you get bit? What's the first aid? What's the protocol? Well, it is a herpes virus, right? But it causes a fatal encephalomyelitis in humans, right? So what does that mean? The brain. And the virus naturally infects macaques. We discussed that. It's a disease that's similar to herpes simplex that you see in humans in the monkey, right? So they may get the sores on the mouth or the genitals, like a human would with herpes simplex. Herpes B affects the monkey in a similar way. And in a monkey, it's generally asymptomatic, but in a human, it's pretty dangerous. Humans have been infected via animal bites and scratches, percutaneous inoculation with infected material. And of course, like I mentioned, the splash in the eye. So animals become infected. So from monkey to monkey, they become infected with herpes B, like exposure of the mucosa or the oral or genital secretions, much like herpes simplex in humans, right? The virus will persist. Does this sound familiar? Will persist in the sensory ganglia for the lifetime of the animal and can reactivate, resulting in the shedding of the virus in the mouth and the eye and the genital area. Again, sounds very much like herpes simplex in a human. The incubation period for infection in humans after an identified exposure can go from a couple of days to more than a month. But most of the time, it's within 3 weeks. Some patients present with a progression of symptoms that sometimes first appear near the site of exposure, right? You may have a little sore where the bite is or the scratch. But other people immediately, the first symptoms they'll even notice will be, in the central nervous system, which is not a good thing. There's also presentation that start out with flu-like illness, very nonspecific. Who knows what you have at that point? Then it will be followed by this very abrupt onset of the central nervous system symptoms. And that, of course, is not a good sign. Now, after humans are infected, the B virus replicates at the site of exposure, and it may result in like a vesicular rash at the site. You may also have tingling and itching and pain and numbness. The virus will spread along the nerves of the peripheral nervous system to the spinal cord and to the brain. And that's when you start getting the real serious symptoms, which can include paralysis and respiratory failure, in even coma, and of course death. And there are antivirals that can be given now, but even among the untreated people, the mortality rate, right? The percentage of people that die from bee infection is somewhere in the ballpark of 70 to 80%. So 7 to 8 out of 10 people that would get infected with this, if they were untreated, had no antivirals, would die. Right. Now, the mortality rate has declined over time since the advent of the antiviral therapy has been instituted. Now, there's a whole bunch of, I'm looking at this list of cases, some well-documented cases of herpes B infection, bulk of them, a third to a half of them are from monkey bites. And there's, a handful of monkey scratches, wound contamination with monkey saliva. And you have to imagine that most of these, or a good portion of them, have to do with primate workers. There's some needle stick injuries. There's one person that caught it when they were cleaning a monkey skull. There's a couple people that got it, that got scratched when they were cleaning the cage or working in the cage. So it must have the saliva on the cage itself. There was actually a human-to-human contact, which I thought was pretty interesting. Let's see if I can find that information. The only case of person-to-person transmission occurred in a woman who was applying medication like hydrocortisone cream, both to areas of her skin that were affected by contact dermatitis and to her husband's vesicular lesions, which had herpes B. So, yeah, she was sharing this hydrocortisone cream, treating her own dermatitis, and sharing it with her husband, who had these lesions because of herpes B. Not clear how he got the herpes B, but yeah, that's you just never know. Probably not a good idea to share medication like that. But the one thing about that's interesting about B virus is it is rare, right? And though there's hundreds of monkey bites and scratches that occur with primate workers in the U.S. every year, very, very few infections actually happen. Now, there's been no documented cases of asymptomatic infection, right? If you get herpes B, you're going to show symptoms, and it could go all the way to fatality. So it's very serious stuff. I did a story several years ago about the most lethal viruses out there. Of course, rabies was on top, and followed by Ebola and some of these other ones. But herpes B was right there at the top 3 or 4, 5, something like that. So, yeah, it's a doozy. So, well, what should you do if you are exposed via a bite or a scratch or whatever? Well, CDC has this handy dandy page with first aid and treatment for this type of scenario. And of course, the first aid should start immediately. Some serious cleansing of the exposed area, washing and scrubbing, soap and water, povidone and iodine, chlorhexidine for 15 minutes minimum. And then irrigate the washed area with running water for 15 to 20 minutes. So you're sitting there for over a half hour doing this. And you should do this if you do get a bite. You've got to do that prior to them collecting samples for testing for the virus. Because if they take a swab in the wound and they press in there to get some sample for like the PCR testing, it could make things worse because it may push the virus deeper into the wound, which may make the cleaning, the first aid, which is a really, really key part of this, less effective. Some key things to know is that do you need antiviral therapy or not? And there are some very specific things that the CDC lays out here for you or your doctor to look at. And one is, the type and the physical condition of the implicated animal. And you have to remember that only monkeys of the macaque family are natural reservoirs of B virus. So other monkeys are not going to carry the risk unless they became infected by a macaque. Number 2 is thoroughness and timeliness of wound cleansing procedure. The wounds that have been cleansed within 5 minutes of exposure, so you got to get on this quickly, and that have been cleansed for at least 15 full minutes are less likely to lead to B virus infection. So any kind of delay, any kind of inadequate cleaning will increase your risk of infection. What kind of wound is it? Number 3, what kind of wound? The nature of the wound. Bites or scratches that break the skin, and especially deep punctures, are obviously higher risk than superficial wounds, and because they can be more easily cleansed. And much like with rabies, wounds to the head or neck provide, much more rapid access to the central nervous system, and you got to consider that higher risk. Then any kind of exposure to materials that came into contact with the macaques, right? Saliva getting into your eyes, accidental needle sticks, that kind of stuff. That's all got to be considered when you're determining whether to give antivirals. And, CDC does stress that none of these potential exposures can the risk be considered zero. So there's always going to be some risk. And the antiviral treatment that is recommended for particular exposures, right? The deep puncture wound, the laceration, the cut or the bite to the head or neck, a needle stick or some other type of exposure is an antiviral. And there's a couple antivirals that they use is valacyclovir and acyclovir. And then you take it for about 2 weeks of time. So it's a long treatment. And so if you do come into contact with some of these macaque monkeys while you're in Central Florida, don't get too close to them. And if you do get bit or scratched, clean it immediately and, go to an emergency room or something like that so they can start some kind of treatment on you or at least assess you or to determine whether they think you need antiviral therapy. All right. So got a lot of things going on today. Real quick before the hard break, we have the website been keeping a real close eye on the rubella outbreak over in Japan. And of course, it's been the largest outbreak in a number of years. And it's primarily in men, middle-aged men, 39 to 56. And a lot of these guys were never vaccinated because they were only vaccinated high school girls back in those days in Japan. So that's making all these guys really, really vulnerable. So they're going to start vaccinating these men for the next 3 years to try to get everything up to snuff. So if you want to check out more about that story, outbreaknewstoday.com. And after the break, we're going to go ahead and take a look at Venezuela. have we been, I mean, we started providing arms to Saudi Arabia over the Yemen crisis back in 2015. You'd hardly even heard anything about that until just recently, right? What a mistake. Why should that be, right? Afghanistan, 17 years. Why are we not out of there? Why aren't they reporting on this kind of stuff? Why aren't they reporting on the debt? We have a real debt crisis going on, right? We have entitlement programs are out of control. Social Security and Medicare are running in the trillions of unfunded mandates, and the numbers are out that, I mean, they don't have that many years left, according to the statistics, and nobody's really talking about it. Nobody really cares. We're worried about Stormy Daniels, or worried about nonsense like that. And 24/7, you got to be talking about more than that. Anyway, one thing we should be talking about a lot more, and it's a great example for Americans to really know this, and something I've been looking at for years now, is the situation in Venezuela. And what has happened from the Chavez administration now to Maduro, and the absolute devastation and horrible things that are happening to those people there. So I want to talk a little bit about Venezuela from, of course, sticking with the theme of our radio show, from the healthcare aspect. And first, let me go ahead and play a short clip about some of the stuff going on in Venezuela.
Inside Venezuela, it's a losing battle to save those who become ill. The country's crumbling health service has all but fallen. Here the patients are stacked up in corners, knowing the odds are they won't leave here anytime soon. And many won't make it out at all. One of the few medics still working tells us they're only taking emergency cases, and everyone has to buy their own medicines, bandages, even gloves. And Gloria can't afford them. She says she needs a metal pin for her broken leg, but with no supplies, she faces a long wait.
And they're using water bottles to keep the weight to try and keep the traction.
Gloria's in terrible pain, wincing continuously.
When do you think she will be able to have the surgery?
Como un mes más o menos, un mes y medio.
About a month and a half.
She'll have to wait a month. Maybe 2 months.
Maybe 2 months.
Whoa.
Or 3 months.
Or 3 months. Wow.
Esto es una tortura china, estar uno así móvil.
It's Chinese torture to be here like that.
They have to care for their own relatives because there aren't enough nurses.
Many of the medics have given up because they can't survive on the minimum wage they're being paid. Those still here are doing it for virtually nothing.
Everything here is so sad. I can not help them because they need help. There is nobody here. They're so
Helpless?
see, yes, and they need our help.
The hyperinflation in the country has virtually bankrupted the hospital. They struggle to buy light bulbs, and parts of the building have had to be boarded up.
Oh, they've had to completely close it? Because you had no supplies?
Porque no hay personal.
This is in an opposition-controlled area, dependent on funding from the central government, but without money for medics or supplies, it's unusable. Dr. Emily Montilla shows us cupboard after cupboard empty of all medicines. She says doctors can't survive on their salaries. She's paid around 5 million bolivares a month. A pack of eggs costs 4 million. Everywhere you turn here, there are heartbreaking stories.
In February.
It was in February.
Oh, there she is, moving around and dancing.
Anjali has a brain tumour. The once active 7-year-old has become almost entirely immobile in just a few short months. But there's no cancer treatment available in Venezuela, once one of the richest countries in Latin America. She wants to take her daughter to Colombia where she can get help there, but she needs the paperwork.
But how are you coping?
Pero ¿cómo hace usted para soportar esto?
Porque mi hija, no soporto. Yo tengo 2 meses aquí en esto.
Because she's my daughter, she says, I have to support her and do everything I can to help her. We've been here for 2 months. Every second is a titanic struggle for Cesar. His father brought him in with diarrhea, which they couldn't treat, and multiple complications followed.
What did he used to like doing?
¿Qué te gustaba hacer? ¿Qué le gustaba a él hacer?
Jugar fútbol,
Playing soccer,
andar en bicicleta.
riding a bike,
¿Qué, papi? Jugar con la tablet.
playing with the tablet, he signals.
The play.
His father calls him a miracle. Most with him in ICU died. But he needs antibiotics now, which they simply don't have.
Esto es una pesadilla.
This is a
Una
nightmare.
pesadilla porque hay muchos factores.
There are lots of factors:
Sociales,
social,
económicos,
economical,
políticos.
political. And the politics are having a brutal impact. For Cesar and his father, the nightmare's not over. Even so, the young boy waves goodbye, nodding as his father asks if he's okay. Alex Crawford, Sky News in Venezuela.
All right, so if you don't know much about Venezuela, it's in South America. It's in the northern part of South America. About 32 million people live there, and it's divided into states. There's a couple dozen states. And it's been under this massive, for several years now, massive humanitarian crisis, economic crisis, socialism, and the government basically socializing every aspect of the country has led to starvation and no access to medical care, and just one thing after the other, and this mass exodus of people leaving the country trying to find a better life. And and of course I want to talk about the health crisis, which is something that is interesting because the government continues to deny it's even going on. And but there's been people down there to take a look at it, of course, from the outside, right outside the border, but they can see what's going on. Human Rights Watch went down there with public health officials and medical professionals from Johns Hopkins recently. And this is what they had to say. This is from Shannon Ducey, an associate professor at Johns Hopkins Bloomberg School of Public Health. And she was part of the team that went down there to the Colombia-Venezuela border to see what was going on. She says, Venezuela's public health system has collapsed, putting at risk the lives of countless Venezuelans. The combination of a failing health system and widespread food shortages has produced a humanitarian catastrophe, and it only will get worse if it's not addressed urgently. In the last few years, the Venezuelan government has sought to suppress data on the country's epidemiological situation, in an apparent attempt to hide the extent of its health crisis, right? And I used to follow Venezuela very, very closely. And I can remember this plain as day, that in 2015, their health ministry they used to put out these weekly updates and boom, it was gone. They just stopped showing up. And well, as somebody who runs a website, it's hard to write stories without some of that data. And B, this kept the public and the world in the dark about, what's going on as far as public health in Venezuela. And then, of course, sometime last year, and you can find the story on outbreaknewstoday.com. Very briefly, they started putting the publication back up in 2017. They had I think they had a new health minister, and well, that didn't last long because she was very rapidly fired. And again, it's a blank space. There's darkness, and there's just nothing there, no data, and so. And and there's been a lot of Fortunately, I've talked to physicians that are familiar with Venezuela, Venezuelan physicians that are here in the States, and I've talked to some. I've had some interviews with them, and but if you're one of these physicians that are down in Venezuela and you're expressing concern about the crisis there or attempting to report any data on it, well, the government will retaliate against you because they don't want this stuff out there. So it's a very, very, as a friend of mine says, a very sketch situation in Venezuela. Let's take a look at some quick numbers of what we see down there. Here's some stuff from CPAZ, CEPAZ. They did a big, long report on some of the health problems in Venezuela in the past month or so. The risk of dying in a public hospital is quite high, causing extreme vulnerability to people due to precariousness of the care conditions. Maternal mortality rose to 66% and infant mortality to 30% in the years 2015 to 2016. And in 2018, they are continuing to rise. And there's a lot of aggravating factors, which include massive, malnutrition, right? What did I read one time? The average person there has lost 21 pounds. And it's not like they're, training for a marathon or anything. There's just nothing to eat. And of course, then there's the epidemics, which we're going to get into in a little bit. And it's something that is very important to this radio show and the website. The number of people served in public psychiatric institutions decreased from 23,000 to 3,500. And those psych hospitals essentially are having a hard time, operating because they can't provide food or medicine. In 2017, malaria was eliminated from Venezuela not too long ago. And what we started seeing in 2015, 2016, and then especially 2017, 100,000, 200,000, 2017, 406,000 cases of malaria and 280 deaths. Remember, this was a country that had eliminated malaria for years and years. My most recent report on the website, outbreaknewstoday.com, I had a quote from somebody who said that the total at that time was about 650,000 cases of malaria. And this organization is predicting that by the end of the year, which it's getting very close, it'll be over 700,000 new cases of malaria and 1,500 deaths. And of course, this has a lot to do with, right? There's a real shortage of medications down there, and there's just no anti-malarial medications to treat these patients, and it's just spinning out of control. The prison system, very, very, compared to the United States, surely, but it's very, very inhumane. Just horrible overcrowding and malnutrition of this population of inmates. And what that kind of has produced is this big surge in new cases of tuberculosis. And they saw about 11,000 new cases of TB in 2017. That was a significant rise. Vaccine preventable diseases has been a big problem. And there's been thousands and thousands of measles cases, something that was wasn't seen there a decade ago. Couple thousand diphtheria cases. I mean, you think measles is bad. Maybe you do, maybe you don't, but it can be a very dangerous disease. Diphtheria is unequivocally a very dangerous disease with about a 15 to 20% fatality rate. So there's been a couple thousand of these things, and several hundred deaths due to these very simple vaccine preventable diseases. And there's just no vaccine coverage going on in Venezuela right now. So it's just a horrible, horrible mess. 300,000 people with transplanted organs, with hemophilia, cancer, MS, Parkinson's, all these serious chronic conditions, they have been deprived of medications since 2016. Can you imagine if you just had a kidney transplant and you weren't able to have that medication that you require post-transplant? Unbelievable. 140,000 people with cancer and more than 300,000 with severe cardiac conditions their chances of survival are down so low because of A, lack of diagnosis, B, lack of treatment, and C, lack of surgery. There's just not the people there to do it and the beds to do it in. About 80,000 people in Venezuela with HIV are not getting their antiretrovirals since last year. And we're seeing that the number of HIV deaths, HIV deaths in most places around the world have dropped pretty significantly. In Venezuela, they saw 1,800 deaths in 2014, and they're predicting they're going to have more than 5,000 deaths this year. What about if you're on dialysis? What if your kidneys aren't functioning and you need this great technology? Well, they're saying that 2,500 of 15,000 people in dialysis for different renal deficiencies died during the last year. 2,500, and that was mostly due to, get this, faulty dialysis units, contamination, and just deficit and closure of facilities taking care of this stuff. Huge problem. You can't tell me that this kind of system works. You can't tell me that. Some other things going on. 55% of medical personnel. Clearly a big problem, and we have to remember this when we want to socialize our medicine. 55% of medical personnel, 25% of nurses, 30% of laboratory technicians have resigned from their jobs and migrated out. That's it. That's it. Like George Costanza. I'm done. I'm out of here. And you gotta live. You gotta do better for yourself. There's a 64% rise in the bed deficit in Venezuela. So they don't have enough hospital beds. And a lot of the beds and stuff are out of service because of just damage, right? Physical deterioration. 71% of emergency rooms in most public hospitals cannot provide services on a regular basis. And a lot of ERs and a lot of surgical suites are closed. They just can't stay open. Well, here's a number that doesn't surprise me, because this is my training as a younger man is laboratories, right? 100% of labs have severe failures to perform diagnostic tests, and 69% of blood banks cannot guarantee safe transfusions. Can you imagine that? Here we bend over backwards trying to protect our blood supply. 7 out of 10 blood banks in Venezuela can't even guarantee a safe transfusion. Payment of supplies and medicines and lab tests by persons in need of care and a 90% stoppage of public transportation are just making the inaccessibility to public health services, right? if you don't have the buses and the transport people, I'm clearly probably cannot afford cars, right? And even though it's like the oil capital of the world, I can't even imagine how hard it is to get gasoline now. But yeah, 90% stoppage to public transportation, so people can't even get to medical care if they live a distance away. This is a real tragic one. I was really shocked when I read this one. 79% of hospitals do not receive water on a regular basis. Can you imagine sitting here in Tampa, Florida, and say 8 out of 10 hospitals in Tampa don't have any water? Right? You couldn't even fathom that. And because nothing's really being produced there, because there's really no industry. 95% of medicines and supplies and the raw materials to make supplies and the environment and spare parts, 95% of all this stuff is imported into the country, and it's just not enough. So yeah, it's a really, really bad situation in Venezuela, and this is something that I will continue to be looking at on a regular basis here on the program and on the website. Outbreak News Interviews, that's the podcast. If you're not familiar with it, you can check it out at the website, outbreaknewstoday.com. Also on Apple Podcast, Stitcher Radio, and Spotify. And the most recent podcast done recently is I talked to Dr. Vincent Racaniello from Columbia University, and we talked about enterovirus D68, the acute flaccid myelitis, and some of the research that he's trying to do. So I encourage you to check out that podcast on the website, outbreaknewstoday.com, Apple Podcasts, Stitcher Radio, and Spotify. Good stuff. Adenovirus. Yeah, remember it was kind of a big story a couple of weeks ago, especially in New Jersey. We had a lot of these young children that died from adenovirus in these New Jersey rehab facilities. And then, of course, last month there was this University of Maryland freshman, who died from adenovirus. Well, since that time, the University of Maryland has reported as recently as Wednesday, there's now been up to 35 confirmed cases in students for adenovirus, and at least 10 of them have been confirmed to have adenovirus 7 by the CDC, which is